Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with board-certified OBGYN and well-woman care physician, Dr. Peter Tseng. We're talking about preventive health care for women. All right, we've gotten ourselves to 65 and older. What are the main health concerns and risks for women this age?
For this group of women, a lot of it has to do with the continual change after the menopause. When the ovaries aren't producing estrogen, different organs and tissues can change. The vaginal tissue, for instance, tends to get thinner, drier, and therefore sexual activity can be more of a concern. And we do have ways to address that or to sometimes treat that. Changes with the bones, also very important. Bones do get weaker fairly quickly after the menopause, so we can address ways of slowing that progression down or treating that if women have very fragile bones. Vaginal prolapse, if the supports around the vagina get loose, women can have problems with things protruding into the vagina or even sometimes outside of the vagina. So these are things on the exam we can look for and address.
Are some women still having symptoms of menopause after 65?
Yes, unfortunately, a small percentage of women may go sometimes the rest of their life with menopausal symptoms, but the majority within 5 years things have gotten better after the periods have stopped, but there are a small percentage of women that can continue to have symptoms, yes.
And do you discuss hormone replacement therapy then, or is that just verboten as you age?
We definitely look at options, and there are hormonal and non-hormonal options that can be used for symptoms. Generally mild symptoms, we will try to go without hormones or even medications, and if the symptoms are bad enough, we can talk about the pros and cons of these types of medications and hormone use.
So what are routine screenings then for this age group?
Routine screenings still would be things like the mammogram, bone density testing, colonoscopy, and there are some women who would still have regular pap smears done, and there are some women who don't need pap smears at this point. For instance, a woman who has had a hysterectomy, especially if it was not done for any type of cancer, can no longer have or no longer need pap smear tests. But we still want to have women come in on a regular basis so we can discuss whether they fall into this group or that group to see what the best screening would be for them.
And immunizations for this age group?
Immunization is very important. As we all get older, our immune system tends to be a little bit weaker, but certainly flu shots. We had a bad flu season this year, and flu shots is one way to help decrease the risk for that. Pneumonia vaccinations, the shingles vaccination, the Tdap or tetanus, diphtheria, and pertussis, very important, especially if they have grandchildren. We're trying to have people be vaccinated for the whooping cough or pertussis, and so these would be all important vaccinations and immunizations to talk with your doctor about.
Well, you've given us great information and incentive to take care of ourselves. Do you have closing comments?
Yes, I just want to just remind women that screening is important. It's important to try to find problems early, things like cervical cancer and breast cancer. We've got very good screening tests, and even though there may be lots of different recommendations out there that it can be confusing, the important thing is to get the screening done, talk to your doctor about the different screenings that are available, and then to determine what would be best for that person.
Thank you so much for joining us.
Thank you for having me.
And thank you for joining us. If you have any questions about anything we've talked about, please call us at Health Access, 1-800-228-1484, or you can always go to our website, and that's mclaren.org/PH contact. You know, you can always get reliable health information or request a copy of this program. That's mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.